And that sound can only mean one thing. We are live on Facebook and YouTube for The Big Show TV. And we have a very special guest in the studio right now. It's Dr. Nicholas Yeo. He's an orthopedic surgeon at Mount Elizabeth Hospital. And today, specifically, we're going to be talking about the rise in injuries among Singaporeans for when it comes to their ankles. That's specifically what we're talking about. I mean, for us to have a whole half hour of the show on this, it must mean that those numbers are quite high, Nicholas.
Yes, indeed. Good morning, everyone. Thank you for inviting me to the show.
No worries.
And today I'll be talking a little bit about injuries to the ankle, and certainly in recent years I've seen an increase in patients coming in with ankle injuries. I feel one of the main reasons is really Singaporeans are embracing a much more active lifestyle. In the last 10, 20 years, you know, your friends and family that do marathons, ultra marathons, you know, now we're into high rocks, into things like CrossFit. And of course you have the usual weekend warriors, not
The
exactly in
footballers.
peak condition. And a lot of them come in and they do have significant ankle injuries. And I would say this is one of the most common conditions I see in my practice. And I'll be very happy to share, some information on this today.
That's interesting that ankles would be so common. I would have thought back would have been a bigger...
Or even knees.
Or knees.
Yeah.
Well, if you think about it, your entire body weight is on your ankle. So basically, it takes the load of your entire body weight.
That's true.
And certainly in activities that require jumping, running, and landing, and a lot of these sports require to land and pivot. So a lot of ball games, a lot of racket sports put you at very high risk of injuries of this nature.
Wow.
Yeah, I've seen shots of like tennis players, especially when they're playing on a clay court. The sliding and the angles that their ankles get to, it's absolutely incredible.
No, you're absolutely right. If you recall a couple of years ago at the French Open, Zverev versus Nadal, he had a really disastrous injury to the ankle.
Cool, yeah.
It was a pain to watch. If you look at the video of it, basically his ankle inverted completely and he required surgery for that. So
It must literally make your heart stop as an orthopedic surgeon to watch something like that and go, I can feel that pain.
Yeah.
Absolutely.
Yeah, wow. Okay, so it's just news is just happening now. They're about to go into sports and then we'll go on air. So we'll need you to say all that you said again. But you come from a tennis playing family.
Yes, I do.
You know,
I
yourself, your wife, your two daughters.
Yes, indeed.
Really hardcore into tennis. Have you guys, knock on wood, seen any ankle injuries in the family because of sports?
Well, thankfully, within my family, we've been okay, aside from the odd ankle sprain, a bit of a knee pain here and there. But I've had friends in the tennis community who have injured various parts of their body.
Yeah.
In terms of the ankle, I had a friend who actually tore his Achilles tendon. So you know, the Achilles is the largest tendon in the body.
Yes.
And again, the entire body weight's on it. And I was actually playing in a competition with him.
Yeah.
We were traveling and he sustained this injury, unfortunately.
Well, good thing he had you next to him. Wow. Oh. Okay, it's just about a minute left and then we'll go on air.
Making Saturday's final with 2 games left. After 3 matches, the unbeaten UAE topped the 6.
You're gonna... Okay.
Yeah.
All right.
For the first time in their careers. Brits move into the last 4 of the US Open semi-finals with a hard-fought 7-6, 3-6, 6-4, 7-6 win over Germany's Alexander Zverev. The world number 12 has also finally broken a Grand Slam hoodoo. Prior to this, he had lost his previous 4 Grand Slam quarterfinals. In the women's singles, Navarro is into the last 4 after beating Spain's Paula Badosa 6-2, 7-5. Up next for her will either be the 2-time reigning Australian Open champion Aryna Sabalenka or Olympic champion Teng Tsin-Wen. That's all for your sports update. I'm Jamit Singh.
Kiss 92 Sports is brought to you by SPC. Formulated with advanced additives and friction reduction technology, SPC Level effectively cleans your engine, restores power and performance for a smoother, more responsive drive, all with greater fuel savings.
You're tuned to The Big Show's Good Morning Doctor, brought to you by Mount Elizabeth Hospitals, dedicated to providing you quality and comprehensive health care. At Mount Elizabeth Hospitals, it's possible.
Wake up.
Wake up.
Wake up. Get up.
You get out of bed this instant.
And turn it on. Glenn, Angel, and the Flying Dutchman. The Big Show on Kiss 92.
No Glenn today. It is Angel, Juliana, and the Flying Dutchman, and our very special guest because it is Good Morning Doctor Day. We have Orthopedic Surgeon at Mount Elizabeth Hospital, Dr. Nicholas Yeo, in the studio today. Good morning, Dr. Yeo.
Hi, good morning.
Should we call you Nick, Nicholas, Doc? What should we call you?
I think Nick's fine.
Nick's fine? Okay,
Keep it
Nick.
casual, yeah.
Okay, nice and casual, yeah. Because we're having a casual conversation about something that isn't, we shouldn't take too casually as well. Injuries in sports, specifically ankle injuries today.
Yeah, absolutely. So we had a chat earlier and I shared that ankle injuries on the rise. I've noticed that in my practice in the last 5 to 10 years, we've seen a huge increase in patients coming in with all sorts of ankle injuries. And I believe that one of the main reasons is really the Singapore population is becoming a lot more active. You know, people are embracing a much more active lifestyle. We're engaging in more sports, marathons, ultra marathons, things like high rocks, CrossFit. You have your weekend warriors, those are playing soccer, playing basketball, racket sports, not in peak condition. And a lot of them come in with ankle injuries. So this is something that I see a lot in my practice, and I'm hoping that today I can shed some light on this, increasing problem.
Funny that he mentioned high rocks, because I just saw pictures of it go around again early this week, which means it happened again last weekend. I feel. I thought it was a once a year thing, but it's been happening quite a lot. And I've seen pictures and videos of people that I don't normally see active on social media, and all of a sudden they're, pushing 100-kilo weights and climbing and jumping and all that. These are the people that you're talking about that should be more careful?
Yeah, so that's a great point. So I think conditioning is key, really, when you take up any new activity. You want to make sure you're in a reasonably good condition. I think there's certain activities like CrossFit and high rocks where you get really caught up in it. And if you're not in reasonably good condition, that's where you can potentially get a significant injury.
Right. My question with these injuries, and I'm sure there are a lot of people listening, and they've all got the same question. I injure my ankle. Sprain. Hot or cold treatment?
Okay,
Good question.
We never know what to do.
That's an excellent question, the Flying Dutchman. So, essentially, when you have an acute injury, of any kind of acute injury in the ankle or otherwise, icing is key in the initial 72 hours. Okay, so initially after an injury, there's going to be swelling, there's going to be pain, there's going to be redness. So what ice does is that ice reduces the amount of blood flow into the area.
Okay.
Helps to bring the swelling down. So that's really key. When you talk about heat or hot presses, that kind of thing, that's more for chronic injuries. So if you've got back pain that's been bugging you for months,
right.
That's going to help, more something that's been ongoing for a while.
Okay.
But in an acute injury where you have a sudden sprain, some kind of injury on the field, you want to ice it straight away, you want to wrap it up. So if you've heard of RICE therapy, rest, ice, compress, elevate. So ice is one of the tenets of RICE therapy.
Okay, so rest, ice, compress. When we come back, I want to talk about that compressing. Yeah?
Okay, join us on The Big Show TV. It's on Facebook and YouTube at Kiss 92 right now. Here's Surfaces and Jake with Don't Let Me Down.
Okay, so we're talking about RICE therapy with Nick. So rest, ice, I understand. Compress, does that mean we bandage a sprain?
No, so you're absolutely right. So in an acute setting, when you have, say, a twist or a bad sprain on the soccer field or something like that, you want to use a wrapping. So basically, if you've heard of an ACE bandage or a Jones bandage, that kind of brings down the swelling and the pain. So you want to go around basically like a figure of 8 kind of bandage. So if you do that immediately, that's going to help prevent excessive swelling right after the injury. So swelling sometimes doesn't occur immediately. It can occur a couple of hours after the injury. So you want to institute this as early as possible. So again, compression is one of the key tenets of early management
Okay.
when you have such an injury on the field. And this is great advice because you don't need to see a doctor for this. You know, if you have an injury, just wrap it up, elevate, ice it, you know, and it gets better.
Ice first, then wrap. Wrap first, then ice.
In that order?
Yeah,
I would,
which one?
I would ice it first and then wrap it.
Ice and then wrap. Okay.
wrap it.
All
Okay.
right.
So now we know it's ice.
I think that helps to solve a lot of the problems, that whole rice technique.
No,
Yeah.
absolutely.
Yeah.
Yeah. So it's something that
Easy
you
to
can remember,
remember.
you know,
Yeah.
offhand.
Yeah, for
And-
sure.
And sometimes if you have a low-grade ankle sprain, you don't necessarily need to seek medical attention. You do that, and after 24 hours, you're feeling a lot better.
Okay. You also mentioned that when you have these ankle sprains, there's a redness. What happens if I get black and blue bruising?
Yeah, so again, that is quite common. So if you have a sprain of your ankle, there's typically a little bit of tearing of the ligaments. The bruising, the black and blue bruising, tends to come on a day or two after the
afterwards.
injury. You don't
Yeah.
tend to get that. So patients tend to get a bit worried. I
Yeah.
often have patients coming in like a couple of days after the injury, and they say, hey, you know, doc, what's going on? My toes and my foot is getting bruised. Is it a blood supply problem? Is that am I having something that I should be worried about? But actually, it's part of the injury. And continuing the treatment we talked about, that's going to bring it down. And typically after a week or so, you'll be a lot better.
Okay.
Okay, which brings me to my next question. When do we see a doctor? You know, a lot of people are going to want to do the rice method, but, you know, you do say that people come in with bruises and redness and all that.
So again, that's an excellent question. That's a very practical question. So for me, one of the keys is whether you're able to put weight on it. Okay, so if you have a significant injury, you're still able to bear weight on it, I'm a little bit less concerned. And if things settle down after 48, 72 hours, it's likely a grade 1 ankle sprain. If you're in a situation where you can't put weight on the ankle, on the foot, then that's a little bit more concerning. In that scenario, I might want an x-ray to make sure that there's no bony injury. So the common injuries around the ankle would be on the outside of the ankle and sometimes on the outside of the foot. It may be a very minor crack, but it's something that we want to pick up, because if we have to institute treatment, if you start walking on a fracture, that's not going to help you.
I think Glenn was on a fracture for a while,
That
remember?
was his foot.
And it was in his foot. So would that be the same for any injury in your body? If you can't make use of, say, your hand, or you lean on your elbow, or, you know, your knee can't bend, or whatever it may be.
I think it's the same principle. If we suspect a bony injury, we want to pick it up and at least know what's going on so that we can immobilize the area. So in the lower limb, that's where we don't want to avoid putting weight on it, because sometimes it may not be as painful as you know it seems. And if you put weight on it, it doesn't help. It doesn't heal. Yeah.
Okay.
So with sprains, should I keep the weight off? Because with rice, again, we're talking about elevate. If I am moving around, do I keep weight off? Do I use walking sticks? Do I use crutches?
Yeah, so if it's, again, it depends on the grade of the sprain. So typically it's graded 1, 2, and 3. A grade 1 sprain is typically a very minor one, and most patients don't even seek medical attention. If it's grade 2 or 3, significant swelling and bruising, then it would be prudent to elevate as much as possible. A lot of times I would put the patient on a boot. So if you've seen these
Moon boots?
yes, moon boots
Yeah.
or space boots.
Yeah.
So that takes some weight off the ankle when you put weight on it. So essentially, it actually allows the patient or individual to walk around, but yet protect the ankle at the same time. So a lot of times you need to get into work. At least you have the boot on. That takes some weight off, even though you're walking on it. But certainly in higher grade sprains, I would advise probably like 5 days off work. You know, keep the leg elevated as much as possible. Again, so it's what we call protected weight bearing. So, you know, it's common sense, really. You don't want to put weight on the area that's injured.
I
That's
always
interesting.
thought those boots were more like casts. I
yeah,
never
I
really.
thought
I
the
thought
same
they were for
thing.
brakes.
Yeah.
For what?
For brakes.
Oh, for brakes, right? I
Yeah.
thought you meant like brakes. Okay.
Yeah, no.
But I always thought they were casts. But you said it actually helps to lift weight off the
so
leg.
essentially it's called an air cast. So there's a bladder inside the boot that is pumped with air.
Oh, right.
So in that sense, it
Your foot is
takes
kinda
off
like-
some of the weight when
like
when
buoyant almost? It's almost like a
little
float?
bit like
right.
that. Yeah.
Okay.
So Flying Dutchman's right. if you have a fracture, we
Yeah.
sometimes treat you in a boot. But again, it depends on the configuration and specific type of fracture. Sometimes it's not amenable to it. You still need a cast. But with this option, it allows you to graduate to a boot at some point in your recovery. So in the past, when we didn't have a boot, you'd be on a cast for like 6 weeks.
Yeah.
Yeah.
Really inconvenient in terms of work and getting back to your life. Really.
Okay.
Yeah.
Okay, very cool. All right, we're going to go back on air. We'll talk about footwear.
Yes.
Kiss 92 traffic.
On the KJE towards the BKE, right after the PIE entrance, look out for a broken down vehicle. Also on Yishun Avenue 1, an accident has been spotted after Yishun Street 81. This is in the direction of Yishun Avenue 2. Look out for that. If you have any other news, it's 885550 It's Good Morning, Dr. Day, and we have in the studio with us Dr. Nicholas Yeo, Orthopedic Surgeon at Mount Elizabeth Hospital, and we're speaking about injuries, very specifically ankle injuries. So, Doctor, earlier you were on the Big Show TV, you were talking a little bit about the recovery of, say, a broken ankle and putting that foot or that ankle into what we call a moon boot. What is the technical term for this boot?
It's technically called an air cast boot. So basically, like I mentioned before, the boot has the bladder that's filled with air, and it takes off some of the load off the ankle.
Okay.
So in certain cases, well, even in a sprain, you may not necessarily have a bony fracture. But if it's a significant sprain and you have difficulty putting weight on your ankle, having a boot helps.
Okay.
Helps you get back to work, get back to your daily life a lot quicker. Yeah.
And I'm just wondering as well, when we're talking about ankle sprains, how important is footwear? I always had the impression if you wear high-cut boots, maybe it gives you more support. Does it, help you with sprains in that way?
No, absolutely. So I think shoe wear is of paramount importance when it comes to preventing ankle injuries. For example, if you are going for a hike, so if you go for a hike, you need to navigate uneven terrain. That's why hiking shoes or hiking boots tend to be higher cut. So you lace them up and you get more stability, so that prevents an inversion injury. So the most common type of ankle injury is when you roll inwards. So what we call the medical term an inversion injury,
Right.
and that results in an injury to the ligaments on the outside of your ankle. So in that sense, certain types of footwear are important for certain activities. Just to elaborate a bit more on that, so everyone has a different type of foot shape.
Yeah.
So some people have a flat foot, some people have a high arch foot. So the type of footwear that's appropriate for different foot shapes is something that you have to think about. In this day and age, a lot of contemporary brands of shoes, they actually have models that are designed for patients with different shaped foot. So, like I said, most commonly is the flat foot. So in a person with a flat foot, if you look at my hands over here, the foot pronates outwards like that. So you lose the arch on the inside of the foot or the instep of the foot. So you want a shoe that has a bit more arch support on the inside of the foot.
Yeah.
So there are a lot of brands there are designed for people with this kind of foot because it's very common.
Right.
Slightly less common is someone with a high arch foot. So interestingly, if you have a high arch foot, the foot turns out like that. And persons with a high arch foot are more prone to spraining their ankle.
Outwards.
Absolutely. Because if you think about
Right.
it, if you have a high arch foot and your foot turns out like that, it's going to be a lot more easy to kind of
Flip
turn
it over.
inwards.
Yeah.
So
Wow.
that is something that it's not talked about enough, I feel. So if you know you have a slightly high arch foot, it's going to be particularly important to get a good pair of shoes that prevents your foot from turning in too much.
Wow. Okay.
And in certain situations, you might even need an insole or an orthotic
Wow.
within your shoe to prevent that from happening.
Oh, wow.
Oh, wow. That's very interesting information. We're speaking about shoes, we're speaking about sports, we're speaking about spraining your ankles, I also want to talk about a different type of shoe. I want to talk about the high heels. And we'll do that on The Big Show TV. Join us on YouTube and Facebook at Kiss92. The time right now is coming up to 8:20.
Kiss 92 Time Check brought to you by...
So I know we mentioned sports, but I mean, there are also a massive group of people in the world that wear high heels. And high heels can't be fantastic for the ankles. Neither are they for the calves, for the back, for anything, any part of the body, because they were obviously invented by men. So
Because men were the first ones to wear them.
exactly. So do you see a lot of injury with women wearing heels?
So absolutely. I mean, this is not new. I mean, ladies have been wearing heels for decades, and it's something I see a lot in my practice. I think for one, state the obvious, it's going to be a lot easier to sprain yourself when your heel's a little bit high. It's a little bit less stable.
Yeah.
So if you walk a little bit quicker, if the terrain's a bit uneven, you could sprain your ankle, just
Yeah.
like a sports person sprains his or her ankle. But more importantly, when your foot's pointed downwards like that, it actually doesn't do any good to your calf. Your calf becomes really, really tight.
Yeah.
So you can imagine if you're on heels all day, it's almost like being on tiptoes all day.
Yeah.
Yeah.
And your calf gets very tight. It's a shortened position. So I always advise ladies who wear high heels all the time to stretch. It's going to be key to stretch your calf.
Wait, before or after?
No, regularly.
Regularly.
Oh, right,
Regularly.
okay.
So it's very simple stretch. It's just a calf stretch.
Yeah.
Put your hand against the wall, have your knee extended,
Yeah.
your front knee bent, and you stretch out the calf muscle.
Yeah.
Yeah.
Because it tends to get tight, and the problem with a tight calf is that it increases the pressure on the front of your foot.
Oh.
So you imagine if your foot's in this position all the time, there's going to be increased pressure on the front of your foot. So ladies who have bunions, who have callosities, who have pressure on the front of their foot, that often comes with a tight calf. And of course, heels don't help.
No, it's a
there
nightmare.
again, you have to stretch.
Yeah.
You have
Yeah.
to stretch.
And just like numb toes,
Yeah.
aching arches, everything.
There's a very old story from a movie called Xanadu that
Yeah.
Olivia
Yep.
Newton-John did. She lived in high heels.
Yeah.
And,
And
in the
leg
entire
warmers.
and the entire movie was shot in flats. It took her 6 weeks to walk around in flats. She couldn't do it.
Yeah.
It was too painful.
Yeah.
I can imagine.
It was just too painful for her.
Yeah. So she needed to stretch.
She needed
to
to
do
stretch.
that. Yeah.
Yeah.
That's right.
Questions coming through on our on our Facebook. An old ankle industry. I sprained my ankle. Does that put the ankle at risk of more sprains? In other words, will it reoccur? Is the ankle permanently weakened?
Okay, that's another great question. Whoever sent
That's
that
from
in.
Molly.
Yeah, Molly. So, I find that generally speaking, if you get one sprain, typically in a young, middle-aged individual, 70 to 80% of the time it heals on its own. You do your rice therapy, give it 6 weeks, 8 weeks, and you're okay. The problem comes when you have multiple sprains. And once you've had one sprain, that predisposes you to having another.
It's true, right? Because my mom was like that. She sprained her leg, and then 2 weeks later, she told me she sprained it again.
Because it's weakened, I
Yeah,
guess,
so
right?
again, that's a slightly different scenario.
Okay.
But within the first 6 weeks, when you haven't quite healed up, you've got to be really careful not to re-sprain it. So that the reason for that is that when you're in a situation when you have recurrent sprains, the chance of you recovering from that is infinitely lower. And these are the groups of patients that tend to come in and require surgery. Again, it's a smaller percentage, but that's usually about 20% of the whole group of patients that come in with an ankle injury, the recurrent ones. So those are the ones I pay a bit more attention to, spend more time telling them, take care of your ankle, try your best not to have another injury.
To make sure you really recover from that first
Absolutely,
one in the first place.
yeah.
Okay.
We've got another question from Winston. Now, Winston's a very active man. He runs, he cycles, he does stuff like that. I know this because I'm related to him. I sprained my ankle years ago, about 20 years. But until now, it still has what is like water around it.
Oh, no.
And it appears perpetually swollen.
Water.
What would that be?
So, okay, in a scenario where you have an old injury, now we are talking about the sequelae, or what are the complications of having a remote or a sprain of the ankle in the past. So I see this a lot in very active individuals who come in and they tell me, hey, over the last 10, 20 years, I've had multiple sprains. And I see it in footballers as well. This is a scenario where there's a name for it called footballer's ankle. Because when you have multiple sprains, what happens is that the ankle's not completely stable. You have enough strength that you compensate. You still play, you still run, you're still able to be active, but the joint gradually wears out. So it's a slightly different scenario. The joint, you start getting a bit of bone spurs, this joint degenerates a little bit, and you eventually get arthritis of the ankle.
Ooh.
So in the stage where you get early to intermediate arthritis, that's when you can come in with some swelling. And it can be a little bit chronic. It might be a scenario where you can still run, I can still do my sports. At the end of the day, I find that it's a bit achy and it's a bit swollen. So that's the scenario we're talking about. So interestingly, just as a comparison, knee and hip arthritis is common as well, but that tends to be more wear and tear, age-related.
Right.
When we talk about the ankle, it's always post-traumatic. It's always due to an old injury. You could have had a fracture when you were younger. You could have a bad sprain when you were younger. That's why it's often seen in sportsmen.
Okay.
Yeah.
Okay.
Wow,
Okay,
that's
we're
quite
going back on air. When we go back on air, this will be our last on-air talk set. I just want to ask, are there any exercises for the ankle that people can do, say, pre or post exercise sports? And maybe any particular sports that you've seen on the rise that is giving rise to ankle injuries? Just a little bit of an insight for any parents, especially listening.
Yeah.
Okay, we'll go for traffic.
Kiss 92 traffic.
On the BKE towards the PIE at the Mandai Road exit, look out for an accident. Also on the AYE, a vehicle's broken down before Tuas West Road's exit. This is towards the MCE. If you spot anything at all and we need to share that information, our number is 885550 We're back on the big show with Dr. Nicholas Yeo of Mount Elizabeth Hospital, and we're talking about ankle sprains in particular, or ankle breakage because of sports. Are there any particular new sports that you've seen on the rise that's contributing to the rise in ankle injuries?
So like we had a chat earlier, one of the sports that I've noticed seems to be more popular nowadays is bouldering. So bouldering's a bit different from rock climbing. So bouldering doesn't involve any safety harness. So you're just climbing up a wall, not as high as rock climbing. But I've seen quite a fair number of youngsters who've come in and after a fall from bouldering, come in with a significant ankle injury. So I've noticed it's become quite a popular sport, and I think that's something that we need to be a bit careful about to prevent such injuries. The other sport that's really taken off is pickleball. I myself play tennis, and I've dabbled a little bit in pickleball, but I've noticed that it's become very, very popular in recent, and it traverses all ages. I've seen people in their 70s, people and teens, some kids to play it. And again, whenever there's something new and you get caught up in it and you're not quite conditioned, that's the where you can get an injury.
Okay. Any advice you could give to anyone who maybe feels like they have a weak ankle, or they're about to head out and do a sport right now as they're listening to us? Should we be warming up our ankles? Should we be cooling down our ankles?
Absolutely. So strengthening of the ankle is paramount. It's key to prevent injuries. There are not a lot of muscles around the ankle, but they're primarily around the calf, centered around the calf. So you want to strengthen your calf muscle. There is a group of muscles on the outside of your calf called the peroneal muscles, and these are the two groups of muscles you want to strengthen. Simple exercise is really a heel raise. So when you do a double or a single heel raise, that's when you strengthen your calf muscle. To strengthen the peroneals, you need a TheraBand. If you've heard of a TheraBand, it's kind of like a springy rubber band, and you sling it across the edge of your foot. And it's a resistance band. And when you do the exercise where you turn your foot outwards, that actually strengthens the peroneal, which are on the outside of the calf muscle.
Right.
So those are the two main groups you want to strengthen. One other activity that's quite useful is to get your balance right. And if you've heard of a wobble board,
Yes.
so in the gym, you've got a wobble board, which is it's a semicircular kind of balance board, and that's really good to train your proprioception or balance receptors in your ankle. So those are the receptors that help prevent an injury. So if you've ever had a situation where you almost felt you've sprained and you've caught yourself, that's because your balance receptors are activated strong enough to prevent that injury.
Wow, some great tips there. Balance, huh?
Okay.
I've got one other question.
Last one.
And this is when I have an injury. There are ankle braces I could put on.
Okay, so
and there's KT tape.
Okay. All right. So
Which
again,
one?
Yeah, which one?
I get that a lot. Okay. Taping's been very popular nowadays. I think a lot of physios do it.
Yeah.
You go on YouTube. You know, you get yourself taped up. I think taping is great because it's not as bulky. You know, especially when we're playing sports, you're on the field, and the rigid tape, really good quality, gives you as good stability as a lot of braces. The issue with taping, I find, is that some patients of mine tape themselves every day, get on the field. It's skin. You be really careful with your skin. If you've got fragile, thin skin, you've got to be a bit mindful of that. Because I've had patients that come into really bad skin conditions after taping for maybe weeks at a time. So that's just something to be mindful of. I think braces still have a role. There are a lot of low-profile braces now that give adequate stability. But one thing I find is that I don't want my patient to be too reliant on a brace. Because at the end of the day, you want to strengthen your muscles and rely on your own anatomy to protect your ankle.
Okay, fantastic. Thank you so much, Dr. Yeo. We wish we had more time with you, but it looks like we've run out of time talking about ankles. Very important stuff. You can always rewatch this on The Big Show TV. Thank you very much, Dr. Yeo, for being here with us this morning.
Thank you, all of you. Yeah,
Thanks.
Thank you.
Thanks for tuning in to The Big Show's Good Morning Doctor, brought to you by Mount Elizabeth.